Welcome. I'm your host, Christina Haskin, and there's a saying that your health and your body in your body related to the health of your mouth. And tonight I'm having a conversation with Dr. Kayhan Civelek, who is a holistic periodontist, and we're going to talk about how you keep your gums healthy and what other problems can happen with your mouth. So welcome, and I just want to tell the audience a little bit about your background. Dr. Civelek graduated New York University with a DDS degree and Ohio State with an MS in cell biology. After graduating from the Ohio State University with a Master of Science in oral biology and certificate in periodontics, Dr. Civelek did dental implant fellowship at Brookdale Hospital Medical Center. Upon finishing the program, he started to teach as a full-time faculty at New York University College of Dentistry in the Department of Comprehensive Care. He started his private practice in 1999. Since then, he maintains periodontal practice focusing holistic treatment modalities and titanium and non-metal dental implants. So, welcome. That's
Thank you. Nice
impressive
to be here.
Background.
Thank
and
you.
When did you start being interested in dentistry? Was it as a young man, or how did
Well,
that?
it started probably towards the end of high school. I was interested in medicine and dentistry, and we had lots of family and friends who were in dental field. So it was easier for me to be exposed to dentistry more than medical field. And the other factor is I got a scholarship, so I didn't have to pay tuition. So that was a factor for dental school. So basically, it wasn't a very educated decision to go, more like being affected the people around me. But once I went to the dental school to go to the field of periodontics and implants, that was a very well thought decision. So towards the end of my dental treatment, I decided to become a periodontist. And so it's been more than 20 years now.
Well, you originally came from Turkey. Was that your native country?
That is correct. My father was in the Air Force. I went to junior high school in Dayton, Ohio. We went back to Ohio, and I was able to come back to Ohio State. I received a scholarship to Ohio State, and I was in PhD program in Ohio State dental school and medical school, and I switched to master's degree in periodontics and cell biology. And upon finishing the program, this was 1992, at that time, American Academy of Periodontics made dental implants part of the periodontal training. I felt more comfortable going to a implant program instead of taking some courses within the periodontics department. I decided to go second degree, or implant is not a specialty, but more formal implant training. So I came to Brookdale Hospital for my implant program, and I did a maxi course at Brookdale Hospital. Upon finishing the program, I became a faculty member at NYU.
Oh, wow.
So I started to teach NYU after I finished the implant maxi course at Brookdale. And for about 10 to 11 years, I was full-time faculty at NYU College of Dentistry. I was in a department called Comprehensive Care. That was a very well organized program. Every aspect of every discipline of dentistry, we were working together. I was in charge of periodontics. We had a prosthodontist and basic science people did support our clinical teaching. After that, I became part of periodontology department. And this was about 10 years. In 2000, towards the end of 1999, I started to switch gears, and I became part-time faculty, part-time private practice. After 2002, I became full-time private practitioner. Even though I started to teach a little, but I don't on a full-time basis. I do give some presentation in different dental meetings, local or national, but mostly I'm in private practice.
What drew you to the holistic side of, or that approach to dentistry?
Well, since the grad school years, I did a master's in oral biology, cell biology. I was able to understand how the cells interact within the human system and how oral cells do affect the different cell systems. Like oral epithelial cells is very much working in the same page with the GI tract cells. So this kind of approach is basically more like holistic than a conventional medicine. The second approach is, as I start to teach, I realized that holistic approach was not reactive but more proactive type of treatment, more like a proactive treatment.
More preventative, you mean?
And preventive. So a holistic treatment, the first thing in holistic approach is to prevent the disease before it becomes a major issue. Conventional dentistry treats more like once you have the problem and then try to treat that aspect. And that was the main thing. To be able to see the holistic approach being very proactive and preventive. When I say proactive, certain things in holistic approach or holistic even lifestyle do prevent diseases, including oral disease, oral infection. So those are the main points that took my attention, and I became more holistic. Now, I never forget at the end of the day, I'm an Ohio State trained periodontist. That's what I'm practicing. I am using more and more holistic approach in day-to-day periodontal practice. That's being our understanding of infection. Now,
does that come from the empirical experience of what you're seeing in your patients makes you more?
Correct. My own, not only my personal experience, but what the literature shows us. Especially last 8, 9, 10 years, we start to see how oral infection plays a major role in overall almost every diseases.
Wow.
In the last 5, 6 years, everyone accepts that holistic, non-holistic. Even the government institutions fund these research. Infection. There was an article a couple of weeks ago at New York Times. It wasn't a scientific article. It was a public article in New York Times, how infection, how microorganisms affecting our daily lives, and how microorganisms become the major etiological factor for some disease that we do not really know how to treat.
So the infection, you mean starting in the tooth or anywhere in the body?
Anywhere in the body, but oral cavity is the most, I don't want to say infected, has most number of microorganisms. If you take a small sample from oral cavity with a swipe or saliva, or take any sample from GI tract, intestine, stomach, or liver, oral cavity has the most numbers of microorganisms. So that makes oral cavity very unique. How we have that many oral microorganisms, but if you create a balance between the host and the microorganisms, you'll be fine. So that is a more like holistic approach.
Is that good bacteria, bad bacteria?
That's correct.
Yeah.
That's good bacteria, bad bacteria. They have the balance within themselves. We also have balance between our cells and the microorganisms. If you break that balance, you create a problem. You start the infection, you start the disease process. This is more like a holistic approach. Conventional approach does not pay too much attention to this balance. The whole world universe everything is balanced. The same balance we have in the oral cavity and in the mouth. So any change in the balance within the oral cavity is going to affect every organ system. Those kind of approaches.
How do you test for that infection if it's not presenting as an emergency, so to speak? Is there
last 8, 9, 10, let's say 10 years, cell biologists and technology improved on diagnosing the infection before it gives clinical signs and symptoms, such as bleeding, such as pain, such as swollen tissues or cheek. Those tests are mostly basic science tests, either microbiological tests or biochemical tests. Nowadays, on a regular basis, it can be done in every practice. If you take a small sample of saliva, you can find, if there is or not, 12 microorganisms, which we know as a fact causes major oral infection and systemic infections. Just in order for any microorganism to cause a disease or to cause a pain, discomfort, infection, they have to have a certain number. In microbiology, we call it to establish a colony. That number depends, changes microorganism to microorganism. It changes from 1 million to 10 million. Some microorganisms even make disease if they are less than 100,000. So you have to have, at least in an average, you have to have 500 million microorganisms to see the symptoms such as swollen tissues, pain, bleeding. But with these tests that we have available to us, we can catch these microorganisms even if they are less than 1,000.
And what do you do to change the situation?
Once we have that microorganism, once we know which microorganism we are dealing with, we can modify a treatment modality for that patient. In old days, there was a cookie cutter treatment. Infection, remove the infection. Infected tooth, remove it. Infected gum, cut it. Now we learn that these microorganisms are very site-specific. What I mean by that is certain microorganisms live in certain aspect of the tooth. Take that microorganism, put someplace else, it will not survive. So now we know it's a site-specific disease. Infection, oral infection is site-specific. With these biochemical, microbiological tests, we know which microorganism lives where. Since we also know that their cell cycle, how long they live, that's not known data last 30, 40 years. So we design a treatment plan for not only for every patient, but every aspect in the mouth, a different treatment modality. Let's say for upper right side, you have Fusobacterius nucleatum. Very aggressive microorganism, requires very aggressive treatment. On the other aspect, lower left side, the other side, you have Actinobacillus actinomycomitans, for example, in short we call AA. So you can design a treatment modality based on that data. In some locations, you have to be very aggressive, removing that microorganism. In certain aspects, you don't have to be because there is no need. If you don't dealing with a very aggressive microorganisms, you don't have to do aggressive treatment, removing, cutting the tissue, something
So the
like
immune
that.
system will take care of it.
That is correct. That is correct.
What kind of lifestyle and behaviors lead people to infections and bad gums and so forth? Is it, I know I read something about having too much acidity in your diet and in your stress and smoking and all those kind of things. Can you suggest to people what would be preventative for them to keep their mouth healthy?
Sure. There are a couple lifestyle changes that if you follow or if you change is going to help not only your oral health. When I say oral health, I'm talking about the infection of the gum, the bone. And these are, some of them are very simple. Stop smoking. We all know that. It affects the lungs, but it affects our field more than the lungs because oral cavity is first line in defense. Once you inhale, the heat from the smoke kills the top layer of the soft tissue epithelium.
Oh, wow.
So lungs are affected, but they are after couple months, maybe 6-7 months after smoking out of a cigarette, you'll have problems. But we will see the problem in our field immediately. But on the other side, we have a big advantage. If you stop smoking, everything goes back in 9 months in our field, in oral cavity.
Oh, wow.
So smoking is one thing that needs to be stopped. The other is diet. Within diet, we have acid balance equilibrium, or that balance between acid and alkaline. As you know, acid in any breakdown or infection, you have to have an acidic environment. That's microbiology 101. Certain foods that increases the pH, it makes it more acidic, is going to create more problem for us, mostly in oral cavity. The second issue is drinking is to a certain extent it is a problem, but it's not as bad as cigarette. Alcohol.
Yeah.
Right. and smoking. So stress. Stress is a big factor. We don't really understand that much. We understand to a certain degree. There was an old saying, stress kills. Stress kills. But I think stress affect our field not directly, but more affecting the immune system. Whenever you have stress, your immune system goes down. Any microorganism that wasn't a problem at that before is going to become aggressive because your immune system.
How about sugar and grinding your teeth?
Sugar. I had lots of. I mean, I was addicted almost to sugar. I stopped it. I'm doing okay. Last 8-9 years.
Yeah.
Sugar is the glycoprotein, glucose, or any glycoprotein sugar molecule is the main glue for any microorganism to attach to the tissues. The microorganisms, bad microorganism, attach with the. I'm talking locally. There are systemic effects of sugar, but locally, the attachment of any bad microorganisms to gum surface or bone or tooth surface is going to be via sugar. So you have to eliminate sugar. Now it's very difficult nowadays. Everything has sugar. Even if you don't get white sugar, processed sugar, they add sugar to every food. So try to reduce as much as possible. By doing that, you are going to improve not oral health, but overall every aspect of the health will be improved. Stress we don't know how directly affects, but mostly reduces the immune response. Occlusion, trauma, that is a major problem. Bruxing or clenching. We have different type of tissue distractions via microinflammation, infection, and inflammation via microorganisms. But you can cause the same inflammation without microorganism by mechanical trauma, such as bruxing. So,
what about bad materials in your mouth, like the wrong kind of dental materials that cause inflammation or not?
There are a couple materials that we use less and less. We start to learn 20 years ago. It's not that one of them is amalgam, still being used, still legally. I mean, if ADA
mercury,
uses, there's no states that don't use it. But we have a problem with mercury and heavy metals. That's one aspect. The second is crown restorations, crowns or caps that made not with good quality material. The main component of crowns are chrome cobalt. If you don't use the perfect ratio, it's creating some electrical problem between the amalgams and the crown material.
Wow.
The best material that can be used in the mouth is either gold or titanium, and now zirconium. Last 8, 9, 10 years, amalgam restorations, because of it contains mercury, has been replaced with composite fillings. It has its own problems because it shrinks. It is more prone to secondary decay, but still it's usable. It's a nice material that can be used. But I would prefer to have gold. Gold still is the best material. But nowadays, it is very difficult to convince someone to put gold just for aesthetic reasons. I've seen gold crowns, gold fillings. That was done 40, 50 years ago. It's like it's done yesterday. But just for aesthetic purposes, it is not. So what is the best material in terms of filling crown? Now we learn zirconium or zirconia is being a magnificent material to replace missing tooth structure. Instead of a metal restoration, instead of a metal-based filling, I think zirconium inlay, onlay type of fillings or full zirconium crowns are going to be very, very good.
And you're using that in implants, correct?
Yes.
Just sort of instead of the old metal screw?
Right. Zirconium became as a material, then implant material. Implant meaning be able to go inside the bone. And available to us about 20, 25 years ago. It's been used in Europe more than 20, 25 years.
And it has less side effects than
It
all the
has
rest
less
of
side effects. FDA approved it 6 years ago, so it's available to us. I am one of the early users of zirconium implant. I've been using, as soon as the FDA approved it, I started to use it. And it's a magnificent material. It's a little difficult to use, but in terms of attachment between the bone and the zirconium implants are magnificent.
So if someone loses a tooth or several teeth, implants are now a safer thing to do
They are.
than bridges and the other
Oh,
stuff.
they are. I can be a little more specific, even the root canals. Root canal, my endodontist friend is not going to like me, but I'm talking based on the facts. A root canal has a lifespan, 5, 6, 10, 15 years, most of them, not all of them, most of them. To replace missing teeth with implant is giving a magnificent results. The success rate is 98, 99%. So the number of implants, it's been millions and millions of implants been used all over the world. When you pull all of them, you are talking about 99, 98% success rate. Zirconium doesn't have that kind of a long lifespan, but the results are fantastic. I haven't seen, I've done a lot zirconium implants, non-metal implants. I haven't seen any bad reaction to zirconium from the gum or from the bone.
And how does the implant, it protects you from not having the missing teeth cause problems in your bite? And all that. What are the benefits of getting an implant rather than just leaving a missing tooth?
Once, if someone loses a tooth, that changed the all bite system. The one first order of problem. The second is it starts a problem around the cheek muscles. And the third, TMJ. Remember, this is all a balanced system. TMJ, cheek, the muscles, chewing muscles, the bone, jawbone. So first thing happens is if you leave the side alone, if you don't put an implant, the bone starts to resorb. The bone disappears. Regardless of gender, regardless of age, the bone, once you lose the tooth, you pull the tooth, that bone at that location disappears. To prevent that, we put implants. Implants 100% prevent bone loss at that location. That's one thing. The second issue is if you leave that side alone, the two teeth from each side is going to tilt to close that space. That will change your bite. Remember, every teeth, 32 teeth in the mouth has a certain way of connecting, touching to each other. So one or two missing teeth, not only going to tilt, close that space, also the upper teeth is going to come down. So it's the first step or messing up your whole chewing system. And then you are going to have some TMJ problems. That's something that we really don't know how to fix right now. So you don't want to have a TMJ issues. Of course, if you lose more than a couple teeth, there's a digestion issue. It creates some GI tract issues. So it keeps going on and on and on and on.
What about people that lose all their teeth? I saw somewhere that they have things to sort of, instead of people taking out their teeth, they can implant them in or something.
Oh, right.
The whole arc thing, I don't know.
We have, let's say, in a edentulous case, a patient, we can do 8, 9 implants, not 16 teeth, but you will need only 8 or 9, even maybe 7 implants for upper and lower, and you can build up fixed bridge work on it, and the patient will be very happy. We have cases like that. So if someone
So it's no more taking your teeth out at night and putting it in a jar.
No. My grandmother had those things, but not anymore, right?
But okay, so and then for the person that is not in trouble but wants to properly brush their teeth, floss, all that kind of stuff, to keep their teeth healthy and their gums healthy, it's a preliminary thing, but a lot of people do it wrong. And
that is so important. That is so basic. If everyone uses dental floss properly, we would be out of business. That will be fine with me. It's so critical. There are some oral hygiene is still mechanical. We don't have a silver bullet. We don't have a chemical solution that is going to prevent infection. We just don't. It's very simple mechanical treatment, toothbrushing, dental floss using, and depending to the gap, sometimes we have different type of dental floss available, large ones, narrow ones, so rinses are okay if the patient doesn't have a major problem, no gum infection. Regular brushing and dental flossing is perfect.
What about oil pulling that?
Oil pulling has certain indication at certain patients. Let me be more specific. Oil pulling is a very good way of removing the infection from the soft tissues. At the early stage of gingivitis stage, before it becomes periodontitis, because it resolved before bone loss, depending on the, even if the early stage or late stage of gingivitis, which what I mean by that, infection of the gum tissue, it didn't spread to the bone yet. Oral pulling is a very good way to reverse that process, and you can do a lot of good service by doing that.
What are the symptoms of someone who might be looking at their gums and saying, how, well, to look for spots of trouble before it really gets to be something major?
Right. The first sign will be probably bleeding. Normal gums don't bleed. Our patients say, oh, I overbrushed, I used hard brush. Not really. Normal gums, healthy gum, should not bleed when you brush or when you use dental floss. So whenever you see blood after you brushing, that's the first sign. The second sign is most people do pay attention specifically the color of the gum of the front teeth. They really won't check the back. If there's any change in the color, I'm not saying just the change. Everyone has an idea what their gum color is. If there's a change in their gum color, that's another sign. If there's a pain when they bite, certain teeth, that's another sign. When they use dental floss, it seems they might feel that the dental floss is cutting the gum. Normally, dental floss doesn't cut the gum. If it does, it means you have to see your dentist. Now the water pick, very good, very, very good instrument to clean, to remove the food particles. If it bleeds when you use the water pick, it means there's something wrong. So basically, and then pain comes towards the later stage of the infection. And if you see gum recession, if you see exposed root surface, if you see some yellow appearance between the gum and the tooth, that's another cardinal sign. It's easier to see that. You see white teeth and then something happens, you see a yellow band before you see the gum. That's exposed root surface. That is a sign that you have to pay attention to that. Those are the major cardinal signs, I would say.
What is your most satisfying thing in the work that you're doing?
A couple things. I say to tell the patient there's something, whatever I do, I would like to be proud of it 20 years from now. And that gives me to be able to know that I'll be proud of with service that we deliver. 20 years from now gives me great satisfaction. And also to improve their oral health and to be able to see those patients. I have 25-year follow-up cases. That to see that healthy mouth gives us a great satisfaction.
That's great.